Hello and welcome to another episode of Standing Apart, the podcast where we explore how businesses and individuals can truly differentiate themselves in a crowded marketplace. I'm your host, Nigel Ridpath. It's good to be back after a bit of a hiatus. I've been completing the manuscript for my debut book, and unfortunately the podcast had to take a bit of a back seat for a few months. More of that later, but it does feel great to be back. Coming up, we have a great interview with Gimson, the CEO of Holly Health. We'll unpack the world of health apps and how the NHS can radically improve health outcomes by using them. As always, we'll feature our superhero of the week, this time highlighting an extraordinary achievement at a tender age. And given I've been off air for a while, I have pent up rantage, so my 1 minute rant is back. First, if you'll indulge me, I want to bring you up to date with my book. At the back end of last year, I had pretty much decided that the management book that had been in the back of my mind for years needed to be written. I have loved teaching leadership and management skills over the last 10 years, and I wanted to present some of the lessons in a way that hadn't been done before. So I came up with the idea of using fiction to teach the lessons. I married the 7 management lessons that I wanted to cover with a story from a particular time period. That led to the book's title, The Time Traveller's Guide to Management. In Edo period Japan, we learn about building a high-performing team. In ancient Persia, we learn about personal effectiveness. Motivation is covered in Belle Epoque Paris and situational leadership in Elizabethan Plymouth. The whole idea is to entertain as you learn the lessons. The manuscript is now in the editing process, and I've started a Kickstarter to fund the production process with some really exciting packages. I've put a link in the show notes for more details. The paperback and ebook should be available in early 2026. I do reserve the right to mention the book again over the next few months. I'm really excited for you to read it. You will know by now that I love to offload. There are all sorts of things that wind me up. And each episode I get to have a rant, but in the interest of my well-being, I try to limit myself to no more than a minute. So here is this week's 1 minute rant. Today I'm fired up about something I've spoken about before, but's actually getting worse. Many businesses in the sector that I spend most of my time in, software services, write boring content on their websites. The subjects are usually boring and the content is written in a boring way. But it's getting so much worse with AI. Here are 6 dead giveaways of AI content, and if I can spot them, your customer certainly can too. Number 1, it's all a bit generic. If every sentence starts with, in today's fast-paced digital world, you know you're in AI land. It sounds smooth, but there's nothing original in it. Number 2, buzzword bingo. Words like synergy, digital transformation, robust solutions, strung together without ever actually explaining what they really mean. That's classic machine fluff. Number 3, no local flavour. If it's supposedly from a UK company, but there's not a single nod to the UK market, as things like GDPR or even a homegrown example, it's probably churned out by a bot. Number 4, too polished yet somehow bland. AI writes flawless grammar, but with no personality, no little quirks, no humour, no human fingerprints. Number 5, and this is an interesting one, repetition. The same point gets reworded 2 or 3 times just to pad things out. A human gets bored doing that, an AI doesn't. And finally, number 6, the SEO stuffing. You'll see awkward repeats like IT support London crammed into every other paragraph. That's usually AI following instructions a bit too literally. Once again, there are amazing copywriters out there who will 100% help you stand apart, and they're not expensive. Please, please, please use them. Okay, stop the clock. I had the great pleasure this week of a conversation with Grace Gimson. She runs a business called Holly Health, and I was truly impressed. Having just ranted about AI in content production, listen out for how Grace and her team are using machine learning to improve their health app. It's really inspiring. So it's my great pleasure to welcome along this morning Grace Gimson from Holly Health, and we're going to be having a little chat about the business and what led you to the point you're at today, and indeed your plans for the future. So good morning.
Good morning. Thanks for having me, Nigel.
You're very welcome. So why don't we just set the scene by having a little potted history of Holly Health?
Yeah, of course. So Holly Health is 5 years old as a company, and we support people with the process of behaviour change through digital coaching. So it's very holistic digital coaching, which helps people to find the right habits for them across mental and physical health, deployed in NHS settings very often, and helps a lot of people with multiple long-term conditions. Ultimately, it's about feeling physically and mentally better and being able to kind of self-manage health over the long term.
Okay, so you mentioned digital. So this is an app of some sort.
Yeah, so we operate on apps and web as well. It actually starts on web for most people because that's a little bit more of an accessible way to get going. A lot of people have never downloaded a health app before, and then we can guide them through that process. But we're running on all those different platforms.
Okay, and who actually buys your product? Is it the health provider or is it the individual themselves?
Most frequently, it's the health provider, and that's very much to do with how we've positioned the service. So we want this to be a service that gets to the people who need it the most. And typically the people that are going and paying for their own health apps and health products are a little bit more affluent, and also a little bit more healthy in general. So we're actually going out there to get to people who don't have lots and lots of disposable income to be paying for all kinds of additional health support, and also where it's of benefit to the NHS and public health and other providers to actually go out proactively and improve their population health through proactive coaching.
Okay, so let's step back a little bit in history. How did the whole concept start?
Yeah, so I had some ideas back when I was a teenager about the challenges that I could see, which to me felt very obvious. So lots of people struggling with day-to-day mental health challenges, lots of people struggling with things like weight management and common long-term conditions like high blood pressure and these sorts of things. And I really didn't see much support out there that was personalized and actually helping them to get by in their day in a sustainable way. So it was very kind of diet culture era with lots of kind of quick fixes, which obviously still does happen, and very little kind of long-term outcomes. And I was also really influenced by the development of consumer-based technology. So my dad worked on some of the first versions of smartphones and tablets in his work at Hewlett-Packard. And I would go in and sometimes be a kind of child demo person in their labs, testing out different technologies and smart whiteboards and things. So I had that kind of technology all around me. And I thought, surely there are ways for us to use these kind of consumer technologies for the better of the population and from a health standpoint. So those are kind of ideas I had or problem areas that I saw. And then it was really over the last kind of 10 years that I knew I wanted to create my own company in that type of area. And then the idea kind of developed over time that it needs to be a fully digital, highly scalable and personalized habit support that's holistic to the different challenges that people have.
And was there much competition when you launched?
I think people instinctively think there is, but the main competition that's out there now and was out there kind of 5 years ago and before that is what we call hybrid support. So where you have a digital app, but actually the digital app is helping you to access support from a human coach, and that has its place, of course, but it's quite expensive to run because you're still having to pay a lot of people on payroll to support everyone. So the ability for technology to be highly personalized and adapt to the individual's needs is massively improving. And so it's really the time now to kind of run these fully digital but still highly personalized approaches, which are much lower cost and more scalable.
Mm. And is your background technical?
Personally, no, but I come from a kind of family of engineers, so
Yeah,
I'm used to having that around me. But no, I have been doing vibe coding recently, if you've heard of that, working with chatbots and things to actually create apps on the fly. But I don't look at the code too much. Obviously, very involved with the product now and over the last 5 years. And in my career before that was very much focused on technologies and tech startups and scale ups. So lots of product work.
Yeah, I'm guessing that one of your early challenges was finding the technical resources that could turn your vision into something real.
Yeah, definitely. Definitely a challenge finding the first team members who are going to lead on the product. And we actually took an approach which I think a lot of startups take when they're setting out, which is working with an external engineering team.
Yeah.
We actually initially started with a low code kind of builder, which myself and my co-founder worked together on. So that got us to our first few hundred users. We were able to test the habit building features and the kind of personalization mechanics from a high level. But then we needed to build the app. So we worked with an external team, which brings challenges, but also opportunities. It allows you to do something quick. But actually, since then, we have redone all of the code ourselves internally, which I think most companies end up doing as they grow.
And where were you getting the kind of research-based health programs from? So obviously you're marrying technology together, and we've just spent a couple of minutes talking about that. But then there must be this element of what good looks like from a health perspective.
Yeah, absolutely. So we have a few kind of clinical and research-based influences in our team. The base team at the beginning was myself, my co-founder, who has a background in neuroscience, and our chief science officer, who has a background in psychological medicine. And we also brought influences in from health coaching. So I trained as a health coach to support people with long-term conditions outside of work. And then just looking at what are the NHS guidelines, things that are quite obvious. So how many fruit and veg do they suggest per day? What are the exercise levels? So we knew what our bar was to get people towards in terms of health and wellbeing goals. And then the mechanics have all been influenced by science-based approaches. So mindfulness-based approaches, CBT-based approaches, acceptance and commitment therapy-based approaches. And then working with more modern kind of research areas, things like behavioral economics and nudge mechanics and things. So we've actually developed now our own machine learning models, which hyper personalize to the individual and their unique kind of communication and motivation styles. And that's through a project with Loughborough University behavioral science team. So we're directly working with scientists that are kind of top of their fields to improve it further.
Wow. So you must look back and think, blimey, that V1 version of the product that you had, 4 or 5 years ago, the journey must have been enormous. If I transported you back in time to when you released your first product, and you thought what the product might look like in a few years' time, would it look like what you built, or are there some real curveballs that have taken you off in a different
Yeah,
direction?
It's interesting because I think a lot of startups over time have quite big pivots to slightly different approaches to what they're doing. But actually, the baseline service, which this kind of low code version was running through WhatsApp, and it was providing people with habit reminders that were personalized to them, helping them track behaviors, helping them track mental well-being alongside. So, but those kind of core features are still very similar, but it's the iterative process of working with members of the public across 5 years, hundreds and hundreds of hours of user feedback, lots and lots of focus groups, working with older adults, working with people with multiple long-term conditions, working with clinical teams. That kind of iterative approach has meant that it just tiny little things that we would never have thought about have gradually improved over time. And I think it's only with that constant R&D effort that you get something that's very usable, and there'll always be more to improve. So it has come a hugely long way, but the core features are still the same.
And how did you go about funding the whole project?
A bit of a combination. So right at the beginning, I self-funded a chunk. So I was working in a company previously that was acquired by Facebook, which was an interesting process to be part of.
Sure.
And
That might be a whole different podcast.
yeah, probably. But yeah, so that left me with a little bit of funding and time and energy to just get going and get the first team members in. And then we raised from kind of friends and family and angel investment. And we have now raised a bit more than 1 million from kind of external investment, and about 1.5 million or more from government grants and government funding. So it's very, very in line with what the government's trying to achieve now with the big three shifts that you might have heard of. So more focus on prevention, community-driven health improvement, and digital approaches. So we have been lucky to be backed by the government on quite a few different projects.
And as part of that, do they open doors for you?
No, I think probably most people would tell you that there is a gap, which is, I'm sure there are lots of people trying to solve for this right now, and things are starting to happen. But there's a really good kind of R&D early kind of funding landscape in the UK when you have an impactful, scalable product that solves big problems. There's what people call the valley of death quite often. Once you've got the first product, and then it's about opening doors and selling it. Right now, that's very much based on your own team, your own contacts, your own just resourcefulness and long-term commitment. So the way that we started working with the NHS was going door to door, not out in the physical doors, but with lots of GPs and lifestyle medicine leaders that work in clinical roles. So clinical directors, for example. We got our first pilots through kind of lifestyle medicine champions who would deploy Holly Health to their cohort of patients, built up initial outcomes data sets with a kind of pre-post assessment. So we form a baseline picture of how someone's doing, and then we assess the health changes over time. And with those data sets, we were then able to move on to commissioning with primary care networks. And now we're commissioning with integrated care systems and other kind of much larger organizations.
So I guess your sales process has then changed over time.
It has. And it's never been easy.
No, I'm absolutely sure. And yet, as you say, there's never been a time when the NHS needs this more than ever, really. And you can absolutely see how technologies like this are going to help in the long term to to bring down the investment that's needed within the ecosystem. What do you think it is about your personality that drove you to start your own business?
Yeah, it's an interesting one. And I think there are a few parts to this. So growing up, had an older sister and twin brother. And I think there's an element of being a twin where there's kind of a friendly competition going on. And right from an early age, we were kind of competitive with each other. And I think it was before both of us were even 15. We both knew that we wanted to pave our own path and create our own companies for ourselves. My brother created his at age 16 and he's still running it. And I waited till I was late 20s to get going with mine. So I also think that's the difference between confidence with different people. But so I was quietly confident and observing lots of things when I was a child and teenager. I was just absorbing and really fascinated by the psychology of some people being able to really excel and enjoy lots of elements of what they're doing, and others under similar circumstances appearing to struggle more. So I just wanted to observe and learn about that. And then the drive as well, I think, came from seeing lots of different careers that people had committed to for decades, but still not necessarily being in control of their lives.
Yeah.
So, for example, that my dad was made redundant from a really long career in the 2008-2009 cycle. So I think seeing things like that made me maybe think I need to go and kind of create my own future. I think there's another element of when you have a really kind of stable and really solid start to life, and you think, right, basically any opportunity is mine to go and get, then why not go and do something big and impactful and aim to do something where you can constantly learn as well.
Yeah.
I think the final thing was from a very young age, I don't know if this is a personality trait or something else, but I saw people doing something and thought, if I can see someone doing something, why can't I do that? So saw someone landing as a skydiver demo person at, I think it was the Bristol Balloon Fiesta, when I was maybe 5. Then I thought, I'm going to do that. So I went on to do about 400 skydives later on. So I think it's just that focus of thinking anything is out there if you have the opportunity, and anyone can kind of do anything that they set out to do.
400 skydives probably also points to your attitude towards risk.
Maybe.
What about the business model behind Holly Health at the moment? How innovative have you been in creating the business model? Did a business model exist that you latched onto, or did you have to create it?
Yeah, this is an interesting one. And when I reflect, I think if I had more of an insight into the way that NHS commercials worked before kind of diving into it, I don't know if we would have tried to be so innovative with our business model. So we have taken a different approach in terms of we're going out there with a service which is charged generally on a population basis. So we're saying, for your 1 million people, we will charge this many pennies, and then you can have unlimited use for anyone in that population,
right,
versus the more traditional approach when it comes to condition management and areas like that, where it's one person receives support from one clinician and that comes with a fee, or that's how it's worked out. And even the hybrid approaches where, for example, diabetes programs, it might be £250 for a person to receive a certain number of sessions of support, whereas we're saying the actual cost can end up being as low as £5 to £10 per user per year. So much lower. But we're looking at it from a different lens, which is, if you were able to get support to thousands and thousands and thousands of people in your population, what could the ROI and impact be then? So it's all about much larger scale, and it's just a different angle. Thankfully, now that we have integrated care systems in the UK, there's a slightly different commissioning lens coming through, and I know this is also happening in more kind of government levels. So Department of Health and Social Care and Department of Work and Pensions, they're starting to think, if we have a population that's struggling with mental health and they're struggling with increased levels of sickness, a lot of it is driven by MSK challenges, mental health challenges. A lot of these challenges are highly preventable in the community, and it's such large numbers that need the support. So the model is starting to flip now, and we're seeing that going in with a a large scale kind of population approach, it's resonating, but I think initially people didn't understand what we were trying to achieve.
And so, I mean, kind of picking up on that theme, if you could persuade Wes Streeting to do one thing, what would it be?
I think look out for what's working already and scale up those approaches. And I know the intention is there to do that. It's not the easiest thing to do when we're already in a landscape where there's no spare funding, but the whole approach now with the NHS 10-year plan and other strategies is to think differently, go kind of out of the way to start focusing more on what can digital approaches do to help us get on top of some of these challenges. So I can see it starting to happen, which is good because it's been quite a long time coming. But we just need to look at what's working. There's plenty of data out there of interventions that are doing really good things and basically fund those and get them scaled up.
So what next for Holly Health?
So we have some exciting things around the corner. We're continuing our machine learning work and hopefully we'll have some results to publish there shortly. We're continuing to expand into a wide variety of condition areas. So we're doing more with cardiovascular health challenges, moving more into the health and growth accelerators, which is supporting people of working age who may have long-term conditions. And very excitingly, we're about to launch our white label service as well. So to date, we've been very focused on the NHS deployments with our own branded service, which has the Holly bird as the coach. Our white label service takes the best features from the core service and it enables other organizations to incorporate those features into their own health app. So this is now becoming interesting for organizations doing remote monitoring, managing big kind of gym members, looking at delivering digital layers alongside mental health therapy. So we're basically going to be integrating inside other people's apps, which is really exciting for us.
That's a huge change, isn't it? So it's using what you've learned in terms of the delivery mechanisms. What works in terms of reminding people to do the right things, but then letting other people put their content onto those modules.
Yeah, so we'd essentially sit as one page in an app that somebody already runs and that already has plenty of features and content, but what they don't have is that the personalized coaching layer. We've kind of skimmed it down to what are the core features for that personalized habit building process to feature on one page and still drive those personalized health changes.
And that white label thing must be changing your sales model. You've got a whole new market to go after.
Yeah, what's interesting is even though you would have thought the white label product is for private health sales, we're actually finding that the people that are really interested in working with it are actually working in NHS settings with their services. So right. I think what it will end up doing in particular is actually pushing forward our NHS deployments, but not as the Holly Health app. It might be within somebody else's app and then delivering it out to more people.
That sounds really exciting. You must be thrilled about that new direction.
Yeah, it's definitely really fun.
Well, we're just about coming up on time now. It's been absolutely fascinating. None of the podcast episodes I've done have been in the health arena so far, so it's really interesting to inhabit this world for half an hour, and I'm sure my listeners will agree with that.
Thank you for having me, and yeah, I think if anyone would like to reach out about anything we're doing, then feel free to connect with me on LinkedIn. Or feel free to send me an email as well. And if anyone listening is thinking of starting their own thing, anything is possible and go for it.
Thank you very much, Grace. As with many businesses, Grace learnt that pivoting is necessary to meet needs. It was clear from the conversation that Holly Health has had to do this from both a technology and a business model standpoint. The trick is to understand when to do it, which bits to keep, which to discard, and I suppose not to get too emotionally attached to what has gone before. I shall be watching Holly Health's progression with great interest, and thanks again to Grace for her time. And now it's time for my superhero of the week. Before each episode, I find someone or a business that is doing an amazing job of standing apart. This week's superhero isn't wearing a cape or flying through the skies. She's armed with something far more powerful: her mind. Meet Bodhana Sivanandan, a 10-year-old from Harrow who's just made history in the world of chess. Now you might be thinking, chess at 10? But listen, this isn't your average game on a rainy Sunday afternoon. At the British Chess Championships in Liverpool last week, Bodhana became the youngest girl ever to beat a grandmaster in a classical game. Let that sink in. A grandmaster, someone at the very top of the chess world, outplayed by a child who probably still has to be reminded to do her homework. And if that wasn't enough, in the same tournament she achieved her final norm for the women's international master title. That's a serious milestone in chess, and she's managed it about a year younger than the previous record holder. Basically, she's rewriting the history books before she's even finished primary school. What makes her stand out isn't just the talent, that's clear, it's the focus, the composure, the sheer confidence to sit across from someone decades older with thousands more games under their belt and calmly dismantle them piece by piece. It's superhero stuff, but instead of laser eyes or super strength, it's all about brain power. And let's not forget the bigger picture. Bodhana's success is inspiring a new generation of young players, especially young girls, to pick up the game and give it a go. Representation matters, and seeing someone of her age taking on the giants of the chessboard shows what's possible with dedication and a bit of courage. So this week's superhero is Bodhana Sivanandan. No cape, no mask, just a sharp mind, an incredible work ethic, and the guts to prove that age is no barrier when it comes to brilliance. Honestly, if that doesn't deserve superhero status, I don't know what does. Well, it certainly is great to be back. With the quick starter and book launch over the next few months, podcast episodes might be a bit sporadic. Having said that, I have a fascinating interview lined up with the team behind the world's biggest cannabis expo in Vegas later this year. That's one not to miss. So in short, the best thing you can do is hit subscribe, and then you'll get episodes as they drop. With irksome algorithms and endless content choices, standing apart isn't always easy, even for podcasts. If you found value in today's discussion, take 5 seconds to rate or share this episode. Those small actions make an enormous difference in helping the podcast reach more leaders who might benefit from these ideas. Please do check out the Kickstarter. It launches on 23rd of September, and if you could bring yourself to make a pledge, that would be amazing. In the meantime, I've built quite a library of back episodes now. Why not explore some other topics from earlier in the year? Finally, remember that standing apart isn't just about being different, it's about making a meaningful difference. Thank you for listening. Standing Apart is a Sun Bear Consulting production.